I'm just going to check over where I am likely to press. Governor vessel 26 is located on the middle axis of the face, between the nose and the upper lip. The next point is large intestine 20, known as welcome fragrance. Large intestine 20 is on the lower outer edge of the nostrils. This point is treated primarily to address nose problems. Small intestine 18, known as a cheek bone hole. This point is located on a line below the outer edge of the eye. Hello everyone. I've got my lovely client Melissa here today, who's going to help me formalise where some of the acupressure points are on the face. And I will talk through what some of these acupoints are used for. I'm going to focus on increasing my knowledge of acupressure, and we're going to look in particular at the history of acupressure and then focus in on the particular aspects of acupressure that are associated with the face and acupoints, which cover a number of different meridians and what they are best used for in terms of enhancing well-being. So just before we go into our session today, looking at the particular acupoints that are located around the face, I'm just going to talk briefly about acupressure and the different meridian points, just so that there is an awareness of what acupressure actually is and where it originated from. And then we'll go and look at the face to start with, and slowly I'm going to build up my knowledge across the whole body in terms of where all the acupoints are, and there are hundreds of them for me to relearn. So we're going to start with the face ones today. Acupressure is a traditional Chinese treatment. It is based on the principle of qi, or energy flows through 14 meridians or pathways in the body. You can apply pressure at specific points, called acupoints, along the meridian to strengthen the flow of qi and remove blockages. This can help relieve pain and improve common ailments and promote a sense of well-being. An acupressure point is a point of increased sensitivity located along a meridian. There are 14 meridians: the lung, the large intestine, the stomach, the spleen, heart, small intestine, bladder, kidney, pericardium, triple warmer, gall bladder, liver, conception vessel, and governing vessel. Acupressure is based on beliefs from over 2,000 years ago and is practiced by thousands of people worldwide. It is not a substitute for medical treatment, but can be complementary to this. For many people, acupressure or even self-acupressure can relieve common aches and pains. So firstly, I'm just going to check over the face with my magnifying glass, which I have here. And the reason for this is just to check that there are no contraindications that would prevent me from putting pressure on the face in particular. There are certain points, particularly around the eyes, that are very sensitive. So you need to be cautious when putting pressure on the face and need to check that there are no contraindications, particularly bruising or open skin. So I'm just going to check over where I am likely to press. There is nothing here at the moment which would prevent me from doing this. But do make sure if you're doing this on a client or your partner that you are in tune with them in terms of them telling you if there is any sensitivity while you are pressing, and you just ease off the pressure. Okay, I'm just going to pop that away now. Okay, so now we're going to move into looking at these acupoints around the face, and we're going to start with the first point. So the first point that we're looking at is Yin Tang, which is known as the Hall of Seal. And this is actually an extra point, and a point that lies outside of those meridians that I mentioned earlier. Yin Tang is on the middle axis of the body, immediately between the eyebrows at the root of the nose. Pressure on this point is said to alleviate pain and improve vision. And because of these qualities, this point is frequently used to treat headaches, dizziness, and confusion, as well as eye and nose problems. The next point is Gall Blaader 14, Yang White, which is slightly above the eyebrows in the middle, and you would do both sides at the same time. Gall Blaader 14, Yang White, is used as a pain relieving point, used to treat ailments in the head area such as headaches and infections of the sinuses. Eye ailments including infections, redness and night blindness and other visual problems can also be positively influenced via this point. Urinary Bladder 2, bamboo gathering, is located on the inner edge of the eyebrow in the slight indentation that we have there. It has the same effects as Gall Blaader 14 and is used to treat headaches in the forehead area, sinus infections and eye problems including itchiness, redness and sensitivity to light. If you are massaging this point, you can massage the 2 points together or one after the other. Place your finger on the inside edge of the eyebrows. Apply constant pressure for 1 or 2 minutes. Then move your finger slightly further out from the midline, no more than about 1 centimetre, and apply strong pressure. Release the pressure and move your finger back to Urinary Bladder 2, touching the skin gently without pressure. The next point is large intestine 20, known as welcome fragrance. Large intestine 20 is on the lower outer edge of the nostrils. This point is treated primarily to address nose problems such as repeated nosebleeds, allergic reactions such as hay fever. So with large intestine 20, the 2 welcome fragrance points are located on each side of the nostrils and can be massaged at the same time with your middle fingers, using first steady and then circling pressure for 1 to 2 minutes each. The next point is small intestine 18, known as cheekbone hole. This point is located on a line below the outer edge of the eye, in the indentation immediately below the zygomatic bone. It can be used to treat pain and cramps in the facial area. This point is also effective in treating illnesses caused by wind or draft. To massage cheekbone hole, have your partner sit down or lie down. If you are massaging yourself, you may want to sit in front of a mirror to help you locate the point. Using the tip of your thumb or index finger, locate the point below the edge of the zygomatic bone, below the outer edge of the eye. Massage the point using first steady and then circulating pressure for 1 to 2 minutes each. The final point is governor vessel 26. Governor vessel 26 is located on the middle axis of the face, between the nose and the upper lip. It can be massaged to alleviate psychological and psychosomatic problems such as fever, cramps, and acute pain in the lower back area. Governor vessel 26 can be massaged with your partner either lying down or sitting up. Using the tip of your index finger, apply pressure below the nose on the middle axis, using first steady and then circulating pressure for 2 to 3 minutes altogether. By learning where the different acupoints are, you can slowly build up your knowledge of all of these acupoints over the body. And then depending on what your client is presenting with, or if you're doing acupressure on your partner or you're doing self-acupressure, you can then build up a pattern of what to use depending on the state of your health at the time. And then you can use these particular points to build up a treatment plan for yourself in terms of which areas work best to really help you. And these are the areas that are just on the face. Slowly I'm going to build up my knowledge overall to cover as many points as I can but this will take me some time to do that. So it was a good thing to start just with the face today. You can see even that's quite a lot to take in, and build up your technique and your skill to ultimately be able to do a full acupressure treatment based on a consultation with your client, and building up a treatment plan with them to enhance their well-being. Thank you.